My name is Stephen Hirsch, and I have a pediatric practice in Rockville, Maryland. It's a suburb of DC, and I opened the practice in 2007 as a solo practice back then, but we've since then added a couple more doctors. So PCC was not my first EMR. I had the EMR for a while, and it was good at first. It really did what I needed to do. I was happy with it. But then as time went on, I think as the company grew very big, they didn't have any more customer support, and their product quality went downhill. So I was left with a product that didn't work very well at many times. They kept adding more and more features that were useless to pediatrics. And when I had an issue, I literally couldn't get anyone on the phone that could help me or explain anything. And so that frustration built, and then I knew it was time just to move on. And then I started with PCC, and I did some research, spoke with some leadership at PCC, just walked other practices, just knew historically people tend to be fairly happy with it, and I thought it was time to make the change. What impressed me most about PCC, just from a logistical standpoint, the customizations are good. So I have a particular workflow in my practice. I think all of our practices have very unique workflows. And so I knew, I could match the workflow I want to do with your EMR. And some of it was a leap of faith. You really don't know what you don't know until you start it, but it worked out well. Your patient portal was much more pediatric friendly, which was very important to me. There were some limitations with my old EMR that were very, very difficult to use the patient portal with our families, and so this had that very good. And then, of course, your customer service. I think at the end of the day, you get what you pay for, and a lot of what you pay for with PCC is, I think, the people, right? And it's the getting someone on the phone who answers the phone and who knows how to help you, or will find you someone that can help you. When I have a problem with my EMR with PCC and I need to get it fixed, I feel like the person I talk to takes ownership of it. They want to fix it as much as I do, right? And that's important to me. I feel like they want that to happen. I think it makes us a better practice, and it makes the patients happier, which then translates to referrals and more dedicated families. And so the reporting is good, the dashboard. And so being able to follow those numbers, I think we do fairly well with our dashboard and our quality measures. We really try to improve them in areas that we think are important, but having that information out in front and just in your face is helpful, because it's a busy day and you have to go digging for it. You may not look for it. And so having that data is helpful. The main stop, I guess, is the cost. I thought about it as like hiring an employee, right? I figured like upgrading my EMR to that increased cost was almost like bringing on another employee to make my practice flow better. And at the end of the day, it did make it flow that much better that I felt like I had another employee in the office that's just making it function much better. So, I think you can't, again, I could go back to the phrase that everyone knows, you get what you pay for. And for us, it was, if your practice is financially stable and it's something that you can do, I think it's a worthy, at least, investment to consider.